In this podcast episode, Dr. Bayo shares her personal and professional experiences surrounding medical gaslighting, systemic inequities in healthcare, and patient advocacy. Through candid storytelling and in-depth discussion, she sheds light on how biases impact care, particularly for Black women, and offers practical guidance for patients navigating dismissive or problematic medical encounters. The conversation also explores her journey into medicine, strategies for resident education, the role of empathy in clinical practice, the pitfalls of the current healthcare system, and the innovative resources she has developed for connecting patients with compassionate clinicians. Dr. Bayo recounts a harrowing incident after delivering her second child via C-section when she experienced internal bleeding due to retained products of conception. Despite pressing her call light multiple times, a nurse repeatedly dismissed her concerns, assuring her that her vital signs appeared normal. This near-fatal experience, despite Dr. Bayo's medical background and familiarity with the hospital, highlights how pervasive dismissiveness can be, even for healthcare professionals themselves. Her story underscores the urgency of empowering patients to advocate for themselves and challenges the false reassurance that objective measures always capture patient distress. Dr. Bayo's passion for medicine stems from witnessing systemic dismissal firsthand, particularly in caring for her father, a triple war veteran who struggled to receive proper attention at the VA. This early exposure to healthcare inequities motivated her to pursue a non-traditional path, first studying psychology, then becoming a physician assistant, and eventually a family medicine physician. Throughout, she navigated cultural isolation, learning disabilities, and stereotypes about intellect and demeanor. Her journey is marked by resilience, self-advocacy, and a commitment to challenge assumptions both in herself and in medicine. While advancing through medical education, Dr. Bayo discovered that auditory learning suited her best. Recording lectures and verbalizing content proved transformative, helping her assimilate complex medical knowledge more effectively despite initial academic struggles. She also advocates for integrating activities outside academics, such as teaching dance, which helped her maintain focus. Dr. Bayo emphasizes the importance of recognizing diverse learning styles and calling attention to how traditional education models may not accommodate all students equally. Known for her warmth and positivity, Dr. Bayo describes how she maintains her authentic, happy disposition amidst frequent judgment and challenging clinical environments. She uses curiosity as a mechanism to counteract negativity and build understanding with students and colleagues, fostering growth instead of defensive reactions. At the same time, she acknowledges the emotional toll of being an empathic physician, setting clear boundaries, practicing reflective solitude, and prioritizing small moments of self-care to mitigate burnout. Dr. Bayo stresses the importance of confronting implicit biases within clinical training by having residents and students examine their preconceived notions about patients' motives and symptoms. She promotes asking learners to articulate their assumptions explicitly to raise awareness and encourage more nuanced clinical reasoning. This method aims to reduce stereotyping and improve patient interactions by fostering empathetic, evidence-based care rather than relying on shortcuts or dismissive attitudes. The episode emphasizes the inherent imbalance between patient and provider during medical visits. Patients often arrive vulnerable, uncomfortable, and uncertain, while clinicians operate under time constraints and systemic pressures. Dr. Bayo advocates for intentionality in small gestures, such as always asking permission before physical exams, which can profoundly impact patient trust and comfort. Recognizing patients as whole humans rather than diagnoses or tasks can help dismantle dehumanizing aspects of modern healthcare delivery. Dr. Bayo connects historical and contemporary biases to explain why Black women face disproportionately poor childbirth outcomes in the U.S. She references entrenched stereotypes about pain tolerance and resilience, legacy practices like race-adjusted risk scoring, and notable tragic cases like Mercedes Wells's delivery outside a hospital. Despite ongoing efforts, disparities persist partly because of how seriously concerns from Black women are taken or ignored across care settings. Drawing from her own experience, Dr. Bayo emphasizes empowering patients with collaborative language as a tool for self-advocacy in clinical encounters. She encourages expressing symptoms concisely and specifically, "I can't eat," or "I'm unable to get out of bed," rather than vaguely or emotionally, which can help providers more accurately assess severity and urgency. Equally important is framing concerns in a way that invites dialogue instead of confrontation, bridging patient and clinician perspectives amid systemic time pressures. Patients who feel dismissed are urged to use all available resources, including social workers and patient advocacy programs, whether in-person or external. Dr. Bayo highlights the importance of recognizing and honoring one's feelings of dismissal, as these impact care quality. Her advice includes escalating concerns within the system when necessary and seeking second opinions or alternate clinicians when possible. The episode explores the persistence of medical gaslighting as a systemic issue, especially among marginalized groups whose symptoms often are attributed to stress or dismissed outright. Dr. Bayo recounts being misdiagnosed multiple times before receiving a lupus diagnosis, illustrating the delayed recognition many patients endure. She also discusses how diagnostic algorithms can perpetuate bias and how awareness and education are essential to improve equity. Clinicians sometimes perceive patients' anxiety or self-diagnosis influenced by social media as overreactions or trends. Dr. Bayo counters that such anxiety often reflects genuine concerns and information gaps, urging clinicians to validate patients' experiences and explore underlying reasons behind their beliefs. She advocates asking open-ended questions about symptoms and using these conversations to build trust rather than dismiss. The discussion moves into social determinants of health and critiques the disconnect between wellness trends focused on niche dietary fads and the realities of patients facing food insecurity or low income. Dr. Bayo highlights how private equity-driven healthcare models often prioritize profitable, well-insured populations while marginalizing vulnerable groups, exacerbating systemic inequities and threatening safety net services. Dr. Bayo reflects on how political leaders often scapegoat frontline healthcare workers while avoiding accountability for systemic failures. She cites problematic public statements from officials that breed mistrust and complicate public health efforts. The conversation underscores the need for authentic engagement with healthcare providers in policymaking and critiques attempts to weaponize equity initiatives or deflect blame. Inspired by her own diagnostic odyssey, Dr. Bayo created CliniciansWhoCare.com, a global crowdsourced database of compassionate healthcare providers across specialties. This platform allows patients and families to share positive experiences and find trusted clinicians, fostering community support in an often alienating system. Recent upgrades include enhanced search capabilities and AI verification to maintain integrity and usability. Throughout the conversation, Dr. Bayo exemplifies an approach grounded in empathy, curiosity, and system-level thinking. She stresses the value of connecting human to human in medicine, balancing advocacy for patients with recognition of provider challenges, and maintaining hope through incremental change. Her forthcoming book aims to equip patients with practical tools to engage collaboratively with their doctors, continuing the work of bridging gaps in understanding and care.